Is Dr. Hines going to be on this morning?
Uh, a question to which I don't know the answer.
Mm.
Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We're so happy that you chose to spend this time with us as we will engage in another invigorating conversation. And without further ado, I'll turn it over to our founder, Dr. Randall Maxey.
Very good. I'm going to ask you first, define the word ado?
Define the word what?
Ado.
Without
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 further,
Did
further
I?
ado,
I said introduce.
no, you said without further ado, and
Oh,
Dr.
oh, yeah,
Maxey,
yeah.
yeah, Dr. Maxey is trying to trap you in vocabulary purgatory.
Oh, what I meant by that was I wasn't going to continue on and on and on. I'm a
well,
preacher's daughter. I know how that goes.
well, thank you very much. And Dr. Marks, what pew did you sit in today?
Uh, I, I sat in row number 2 today, Dr. Maxey, but I
Uh,
but I was there.
Okay. Well, good. So we want to have an interesting conversation today, something that we don't talk about much. But first, I'm going to speak about the Honorable Robert F. Kennedy Jr., who has fired all the members of the ACIP, which is an advisory committee on infectious diseases to Health and Human Services, including people like the Honorable past NMA President, Dr. Virginia Kane,
As well as Dr. Oliver Brooks.
Dr. Oliver Brooks. And he's fired anybody who has scientific expertise and believes in science-based medicine. So it's been hardly recommended that going forward, that we at least temporarily avoid listening to the voices coming out of the current HHS and listen to the physicians from the AMA, the NMA, the Association of ACOG, what's that? American Academy of Obstetrician and Gynecologists, the American Academy of Pediatrics, and other such organizations to get your information. And a lot of states now, including Pennsylvania, have put out their own guidelines that are science-based, and it's very important that we do that. But today we're going to speak about a topic that we haven't spoken about before. I think it's timely. And this was spurred in my mind by the idea that there's a 30,000 number of people who've been discovered to have something called Chagas disease, which normally occurs in immigrants and in South America. And when people go camping in those areas or live in some of those adobe type huts, and we don't think it's dangerous to us. And we also haven't taken into account some of the things that can happen sexually in the United States. I wanted to go over this. So let's put the first slide up if we could, Simon. And I'm going to ask my honorable co-host without much ado to assist me with these slides as we go forward.
Well, we are going to talk about human parasitic diseases in the United States.
And this matters because it remains under recognized, but clinically important in the U.S. So what happens? Animals, blood, food, insects, and water can transmit these parasites. Dr. David Stevens?
What is a parasite? Parasites are tiny germs or organisms that live in or on people and animals. Some can make us very sick if we are not careful. You can be exposed at home, in swimming pools, at restaurants, even in your own backyard.
Dr. Wilkes?
Household risk. Pets may carry worms. Pets such as dogs and cats. Cat litter can spread toxoplasmosis. Undercooked meat or unwashed produce may carry parasites. Daycare centers can be places where Giardia and other parasites are spread easily.
So there are swimming pool risks. Some of these parasites, even if you put chlorine in your water, can exist. They can thrive on that chlorine. They can spread if somebody swims and they have diarrhea and they don't tell anybody and have a leak. Swallowing pool water spreads parasites, and outbreaks can be common, especially in the summer, but all year round for people in California. Some people have indoor swimming pools, probably like Dr. Walks. Take the next slide, Dr. David Stevens.
Restaurant and food risk. Undercooked pork can have tapeworms in it and another bacteria called cysticercosis that can cause tapeworms and cysticercosis. Um, Undercooked pork, my understanding, and correct me if I'm wrong, Dr. Maxey, it is more than just undercooked. I mean, you have to it's really not healthy or safe to eat raw, rare pork, or it really needs to be well done. Un
Yes. And we
Correct?
have some slides later that talk about the absolute temperatures that you have to put.
Okay. Undercooked beef. Oh, yeah, we definitely want to talk about this in beef, lamb, venison, and toxoplasma. In the
But
state of Tennessee this week, there was an alert issued because we're having a record high number of deer infected with white tick disease, which if you eat your venison after you hunt it, you can get it. Unwashed fruits and vegetables may carry soil parasites. Contaminated water or ice can spread Giardia or Cryptosporidium.
okay. So there are also backyard risks that can happen. Sandboxes can be contaminated by animal feces, and walking barefoot can allow worms to enter through the skin. And gardening without gloves exposes you to soil parasites. Tick bites, especially in grassy, wooded areas, can spread babesia. So the idea is not to know all the names of these things, but I'm concerned about where there are dangers, and we should know those where those dangers are, not necessarily all the scientific names, even though it's okay to do that. Dr. Walks?
When to suspect a parasite. If you have ongoing diarrhea or stomach pain, unexplained fevers or sweat, seizures, or new neurological symptoms, which are rare, itchy, rash, or skin problems such as scabies or lice.
Dr. David Stevens?
So, we want you to take care of yourself. How can you protect yourself? You need to wash your hands often. You need to cook meat thoroughly. You need to wash produce. Don't swallow pool water. Avoid swimming if sick. Keep pets dewormed. Clean litter boxes safely. Wear shoes outside. Cover sandboxes. Use gloves in the garden.
So that thing, use gloves in the garden. I used to always wonder why I saw women with gloves on, but now I understand that even just doing something as simple as doing your garden, picking your roses, trimming them back can be dangerous. So, what are parasites? So, parasites are organisms that live on or in a host and derive nutrients at the host's expense. Major groups such as protozoa, they're single-celled animals, helminths, which are worms, ectoparasites like lice and mites, and they have a clinical impact that ranges from asymptomatic, you don't know you have it, or they can be severe and life-threatening diseases. Dr. Walks, you take the next one?
Indicative burden across conditions. So on the y-axis, we've got the relative burden index, and then on the x-axis, long ways, We've got indicative relative burden of selected parasitic diseases in the U.S. And this slide is to tell us that the relative burden index is illustrative. Actual burden varies by region, surveillance, and population. So what that means is that this is across the U.S. and may not reflect where each of us lives. Like Dr. Neighbor Stevens said earlier, that in particular in the area where he is, the venison has to be handled maybe differently than the venison has to be handled in some other areas. So every time you see these sorts of charts and graphs and what have you, um, really check to see if it is relevant or relative or I don't even know the word. If it's going to tell you what to do where you live.
So let me ask you, Dr. Walsh, look at the one that is the highest in terms of burden. And as a former public health officer, that I want to concentrate on that for just a second. The one that's the highest on the graph?
The one that's the highest on the graph is trichomonas. Trichomonas. That's it. Why do you want to concentrate on that one, Dr. Maxey? Tell us.
Because that means a whole lot of us potentially are liable to get that because it usually may be asymptomatic, especially in a man. It's sexually transmitted, and people have different types of sex, whether it be oral or anal, and it's a major risk for people. And I'm concerned about that.
So,
And then,
so as I said earlier, Dr. Maxey, these kinds of charts and graphs may not be illustrative for us individually because maybe I'm not out there doing all that stuff you just mentioned. So,
and that's the purpose of that.
right,
And if you look at
right,
the last one,
yeah,
which
scabies,
is
yeah,
also high in the scabies,
yeah.
and that is particularly high, especially with people who travel and stay in hotels, motels, and even the big Hiltons and major hotels have
Oh yeah,
mites and scabies and
yeah.
stuff like that. Does neighbor Stephen take the next one?
Transmission pathways. So fecal oral, Giardia, Cryptosporidium, and Toxoplasma. Fecal oral means that once your hands or a utensil is contaminated, usually from by fecal contamination, you are at risk for Giardia.
And can I
Vector-borne.
just add, this is why every restroom in every restaurant has a sign that says staff must wash their hands before they come back to work.
And we hope they can read.
You know what? Well, a lot of people don't understand that if they're if they have fecal matter, it doesn't have to be that they went and had a bowel movement. It could be that somebody else did earlier and left stuff on the sink or what have you. So you have got to wash your hands thoroughly when you come out of the bathroom and you're going to go serve people food. Just do it, please.
And you so go ahead, that's neighbor Stephen.
Vector-borne, Babesia, which is carried by tick. Vector-borne means that something carries it. Babesia is carried by ticks. That's one of the things ticks can carry. Trypanosoma cruzi, called kissing bugs, which are mainly found in Latin America. Zoonotic, that means that it is carried by an animal. Toxocara is carried by dogs and cats. Echinococcus is carried in dogs and sheep. Sexual, Trichomonas vaginalis. It calls a vaginitis. Transfusion, transplant, again, Babesia and T. cruzi. Congenital, Toxoplasma and T. cruzi. Might I also add syphilis because we're having a problem with syphilis, congenital syphilis these days. Skin penetration, strongyloides, soil, hookworm, rare in the US, but pinworms is not rare.
Okay. So key transmission routes. And this is just illustrative that fecal oral is very high. Vector-borne is not quite as high, but it happens. Carried by animals is the highest on here. Sexual transmission is not very much, but it's significant. So you can see the size of the graph. That means what are the routes of transmission. But fecal oral is something very important. That's especially, can you comment on that in children, especially toddlers, how that can happen, Dr. Neighbor Stevens?
Um, the fecal oral problems are not as great in kids as it is in their caregivers. But the way they could easily tr become subject to fecal oral transmission is children tend not to be as clean as they can be or should be. You made the comment about using soap when you wash hands. I know many people have probably had the experience of having to remind their younger kids taking a bath means using soap. Uh, so that puts them at risk for fecal oral infections.
Yeah, I recall when one of my sons was a preteen and his mother sent him in to take a shower. And I went to check that he was in the shower. He was standing outside the shower with one arm inside the shower, letting that one arm get wet. That was his idea of a shower. So let's go to diagnostic methods. Dr. Wilkes?
Diagnostic method, history. Uh, I'm gonna I'm gonna say that again. History, history, history. It's important if you think someone is being infected by something or picking something up. Take a history, find out where they've been, find out what they've done. So as part of the history, find out about travel, about immigration, about exposure to water, pets, soil, if they've had a recent transfusion or transplant or pregnancy. Getting to know someone is really important, whatever you're trying to diagnose. So history is really, really a big one. The physical exam. Are you seeing a fever, rash? Are you seeing lymph nodes that are prominent or lymphadenopathy? Hepatosplenomegaly, this is for the doctor people. If you're doing a physical exam on someone and you find that their liver appears to be enlarged or their spleen appears to be enlarged, maybe there is something like that going on. Cardiac or neurological signs. Then we, run some laboratory tests. Complete blood count, look for eosinophilia with helminths, stool, ONT, multiple specimens, antigen, PCR test. We will lab you up. And sometimes in order to find out what's going on, you need to run a whole bunch of labs. You need to look at serology for T. cruzi and Toxocara, toxoplasma. You need to get a blood smear for babesia and malaria. And then there's the imaging, the ultrasound, the CT, MRI for cysticercosis, um, echinocosis, a biopsy when indicated. And I think what's important, and when Dr. Maxey put all of this together, is sometimes folks will go to the doctor or go to urgent care and they will get well, we're not sure what it is, and they'll send you home. And they didn't do any of this. They talked to you for a minute or two. They kind of looked at you. Um, I talked to someone who had gone in for an exam of their knee, and doctor never took their pants off. Kind of looked at the area above the ankle, but never actually saw the knee or the area above the knee. So I think when we talk about diagnostic methods, it's important to know what the list is, but it's also important to have somebody listen to you when you're telling them what's going on and what's bothering you. So, next slide.
Those are very good points. So prevention and control. We know that you should use safe food and safe water. That's very important. Avoid unpasteurized milk, untreated water. and make sure you wash or produce your vegetables and fruits. Hand hygiene. Avoid soil ingestion. A lot of kids, I remember when I was a kid, I used to love to eat dust and dirt. Some people eat chalk and stuff off of walls. And that's very unhealthy to do that potentially. And we know that you need to have vector avoidance if there are ticks, if there are mosquitoes, those types of things. And if you have pets, dogs, cats, you need to deworm them. And be careful in the litter box. Wear gloves and keep the litter box hygienic and clean. And also, we want to make sure that if you have a donor that you're going to get blood or organs from, we want to make sure that that is pure and people that don't have conditions that could cause your problem. And we know there needs to be special counseling if you're pregnant or in any way immunosuppressed or if you have HIV. That's something significant. That's Neighbor Stevens.
So now we're going to talk about Chaga disease or Trypanosoma cruzi, the causative agent. In the US, in the US relevance, it's seen mostly in immigrants from endemic Latin America, vectors present in southern US. Transmission, triatomine bugs, rare in the US. Congenital, meaning that it can be passed from the mom to the fetus, transfusions or transplants, or if you eat contaminated food. Clinically, what you might see is acute febrile illness or Romagna sign, chronic indeterminate uh, to massive cardiomyopathies, arrhythmias or changes in the rhythm of the heart, stroke risk, and GI mega syndromes. Diagnosis. Sounds like something you want to know about if you might have it. In an acute phase, you can pick it up using the PCR test. You all might remember us talking about PCR. We talked a lot about PCR during the early days of COVID and looking at blood smears. When there's chronic disease, there are two different blood tests that can be done.
So one of the things I'm concerned about when I looked up Chagas disease, it can happen in a lot. For example, in some of these immigrants that have food trucks or these carts that sell food by the roadside, and that's something that you need to be concerned about. Are they able to keep it at the right temperature? Because you can get it by eating, and that can be a very serious disease. So be careful what you eat, where you get it, especially with unmonitored roadside booths or trailers or food trucks, whatever they are. Dr. Wilkes?
I'm still trying to get over the fact that you're trying to tell me I need to be careful around my food trucks and my sidewalk vendors. That's some of the best food, Dr. Maxey. So I'll try to forgive you for that.
Okay, but be careful.
It's some good food on the sidewalk. But I think it is important, all kidding aside, to to I don't know how we tell people kindly to make sure that their food is prepared properly and it's kept properly. But it is important. Also pretty tasty. Um, Babesiosis, Visa, Microti, and others. Region, Northeast and Upper Midwest. Tick-borne. Exoscapularis. Risk, asplenia, older age, immunocompromised, and can be transfusion transmitted. Clinical, fever, hemolytic, anemia, thrombocytopenia can be severe. I have to say, as we're going through this, Dr. Maxey, these are a lot of words I haven't heard since I took microbiology and uh, pathology in medical school. And so I think some of the general knowing these words and making sure that you ask people about all of the different things that can be making you feel bad, making you have these sweats and making you have all the other things that folks can have. It's important. You don't have to memorize the entire lexicon of microbiology, but you have to know that it's a big one. And there are a lot of different things it can be. So just because you don't have the flu, it doesn't mean there's not something else going on.
One of the things I like best about New York and New Jersey, I used to go hiking a lot. And little did I think at that time that I might have a tick from walking through the grass on some of those trees. So this is just a be careful thing. Like Dr. Wells says, it's not important to remember the names of the diseases, but I want you to see that they can be very serious, like hemolytic anemia. That means your red blood cells are breaking up, and that can be a problem. Thrombocytopenia means you have low clotting factors and you can bleed to death. So all these things are important. So it's the symptoms that happen and the fact that you can get ticked and you don't need to know the name of the disease. And I personally took out all the treatments because we don't want you to try to treat yourself going to into just Google or something like that. But you do need to have, if you have symptoms, you need to go to your physician or provider and start there. Dr. David Stevens?
But there are two that we haven't mentioned, and I'll talk about Giardia in just a minute. We haven't talked about Salmonella, and we haven't specifically talked about Listeria. So we want to come back because those are extremely common um, diseases that occur fairly frequently among a lot of people, almost to be epidemics and lead to the pulling of different food products from the market. But now, Giardia duodenalis, common U.S. diarrheal parasite, outbreaks via untreated water. Now, let me just stop there. When we say untreated water, we're talking about lakes, streams, the ocean, the beaches, as well as well water that hasn't been tested. There are a lot of sources of untreated water. Childcare settings, clinical, acute or subacute diarrhea, steatorrhea, bloating, weight loss, chronic malabsorption possible. The diagnosis is made after testing the stool for the Giardia antigen or PCR.
So Dr. David Stevens, as you mentioned wells, I thought of an image of a well that's at the bottom of a hill and there's a house at the top. And I've seen evidence that sometimes these wells can be contaminated by the waste from the community house on top of the hill to the wells at the bottom of the hill.
It doesn't even have to be like that. Last year, and I don't think the situation has been corrected. There's a significant issue in some area in Mississippi where the normal rain and stuff causes flooding in the backyards, and it makes the septic tanks or the latrines leak out into the land. And they've been arguing with their local government for a long time to try to get that fixed.
Okay. So cryptosporidosis, the scriptosporidium, they're waterborne outbreaks. They're chlorine-resistant pools. I always thought that if you put chlorine in your pool, you were cool, but maybe not. Some of these agents can thrive even though you've got the chlorine so much in there, it makes your eyes red. So it gives you a watery diarrhea, it can give you cramps, severe and prolonged, especially in immunocompromised people, such as advanced HIV if you have that or AIDS. It's diagnosed with SUL antigen, PCR, acid fast stain, and you want to make sure you don't have that. Be careful of public pools while you're symptomatic. You shouldn't go and should make sure other people don't go. So sometimes it's better if you have a private swimming pool in your own house, that's better. Sometimes your public pools are nice, especially in the summer, but you have to be careful of what happens. That works.
Hey,
That's Lawson on you, did he?
I don't see Dr. Lawson. Spondyloidiasis, spondyloides stare coralis, acquired via skin contact with contaminated soil. Autoinfection can lead to lifelong persistence. Risk, hyperinfection with steroids or immunosuppression, HCLV1. Diagnosis is via serology, see if it's sensitive. And then stool larvae, serology for sensitive, stool larvae, low sensitivity. So serology, so if you want to really be sensitive with the test, you use serology. If you use stool larvae, if you're looking for stool larvae, you may have low sensitivity. Is that right, Dr. Maxey?
Yes, sir. Dr. Neighbor Stevens.
Toxicarius, Toxocara canis slash cati. This is one of those that's carried by animals, and this one is carried by dogs and cats. And children are at risk via soil ingestion, as well as if they're not careful in the way they play with an infected animal. Clinically, the larvae migrate and it can cause fever, enlargement of the liver, and an increase in one of the types of blood cells called eosinophils. Sometimes they crawl up into the eye. That's called ocular larva migrans, and it causes blindness. The diagnosis is, again, blood tests and suspicion. When you find it and make the diagnosis, you give supportive care for the eosinophilia.
Okay, Dr. Wilkes.
Toxoplasmosis or Toxoplasma gondii. Exposure. Undercooked meat, cat feces, oocysts, contaminated soil, congenital transmission. Clinical, asymptomatic or mono-like severe disease in pregnancy and immunocompromised. You can have congenital sequelae. Diagnosis, serology, looking for IgM or IgG, PCR tests like Dr. Maxey mentioned earlier, or congenital or ocular disease, and you want to treat in early pregnancy to reduce fetal transmission.
So, Trichomonas vaginalis is the most common non-viral STD. Women often are symptomatic, they have a vaginitis. Men often are asymptomatic. It's associated with preterm birth, increase in HIV people. It can be acquired transmission. And also you want to prevent it by using something called a dental dam. And dental dams are things that you use in dentistry to keep certain areas of the teeth clear of fluid, but you can use them sexually. They have ones that are intervaginal and intranasal. They're like prophylactics you'd be used in your body cavity. And there's a special test that can be done called NAAT. And there's also wet mount, which is low sensitivity. NAAT test is a genetic test that looks at the transmissibility of that. And also you want to treat for multi-days or sometimes singly. And make sure to treat everybody at the same time with all the sexual partners in this particular disease. And during the treatment, you want to avoid alcohol.
You know, condoms can help too.
Of course. Dr. Neighbor, you want to take the next one?
Neurocysticercosis, tinea solium, acquired by eating the T. solium eggs from a human tapeworm carrier. Another example of the fecal-oral transmission route. Signs clinically can be seizures, headaches, increase in the cerebral spinal fluid pressure, which can lead to a condition known as hydrocephalus. Immigrants and travelers are at risk. Diagnosis is made using a MRI or CAT scan of the brain plus confirmatory serology. And you need the ocular involvement or involvement of the eyes needs to be considered first. Treatment is to manage the seizures, and if the hydrocephalus has set in, surgery is done to relieve the pressure by instilling a drain into the brain.
That's like a pretty dangerous one, Doctor. Pretty dangerous parasite.
Yeah, this is not something you want to get.
Hmm. So now this one, Echinococcus. You want to take this one, Dr. Walks?
Echinococcus granulosus multiocularis. Zoonosis from Candid cystic granulosis in the liver, lungs, alveolar sacs. Multiocularis behaves malignantly. U.S. foci in Alaska in the north risk with dog and livestock cycles. The diagnosis is done through imaging, ultrasound, CT, or MRI with serology. And you treat it. I don't know what a pair technique is, but that's how you treat it, or
Yep.
surgery.
I'm going to tell you, this is another super dangerous one. So if it happens, and there's these big cysts that mostly occur in the liver, can also occur in the lungs. And the treatment usually is to stick a needle into these big cysts and put something like absolute alcohol or another drug inside that, wait about 20 minutes, and then aspirate it out and take it out. It can also be taken out surgically, but you still might want to use the pair technology beforehand. But again, this is something that can be severe, but usually it happens in the liver. And it may not be as severe, but it can happen in the brain, can happen in the lungs and the alveoli. So this is another very dangerous disease, and you don't want it for sure. So this one, Dr. Neighbor Stevens.
This one has had a fairly recent uptick in the United States. Most of the time is related to travel with occasional local transmission events. The reason it's beginning to be seen in the southern part of the U.S. is related to the increase in temperatures which support the mosquitoes that carry the plasmodium. The clinical signs and symptoms are fevers that come in a cycle, uh, red blood cell destruction, and there are three, I thought it was four, maybe four types of plasmodium now, with Plasmodium falciparum most severe. There's also some issues now with resistance to some of our mainstay drugs for treating it. Diagnosis is made with rapid antigen blood test, plus blood smear, and PCR is used to identify the specific type of plasmodium that you're dealing with. The treatment is tailored to the species and the severity of the disease. And these drugs are some of the drugs that are used. The other thing about, and you have to check, make sure the person doesn't have G6PD disease before you give these drugs. The other thing about malaria is that this is one of the diseases that you used to be able to reasonably determine whether or not, if you're going to travel, whether or not it is endemic, which means that it is present in the place where you're going. And if it is, you can be put on medication before you go to help you to resist the infection.
So interesting thing, the artemisinin treatment. A lady won the Nobel Prize in medicine. So this is the ingredient found in something called wormwood, and these Chinese people have been using that for years and years. But the active ingredient in treating almost every form of malaria is in that. So even if you use it with one of the more modern medicines, this one kills almost all of the species. And generally, it's something called wormwood, but this is the active ingredient. And she did win the Nobel Prize, even though it's been used for thousands of years. Okay. Uh, Dr. Walks, use this one?
Naegleria fowleri, primary amoebic meningoencephalitis, rare but often fatal. Warm freshwater exposure through the nose. Rapid onset, severe meningoencephalitis. Diagnosis, cerebral spinal fluid wet mount, PCR, and alert lab. Treat it with combination therapy with aggressive critical care. So that means if I move out to Mayberry to hang out with Andy and Mayberry, I can't go swimming down at the pond.
That's what it means. At least don't drink any water when you're underwater.
Oh boy.
Mhm. Okay,
And
scabies.
it occurs fairly commonly down in the southern U.S., especially around Florida.
Yeah. What state is Mayberry in?
It's in a state of mind. Next slide.
Scabies and lice. These are ectoparasites. So the itching, periodic means itching. Infections, outbreaks are in congregate settings, long-term care shelters, nursing homes, and if there's crusted scabies in immunocompromised individuals can be highly contagious. The diagnosis again is microscopy of the skin or little nits you might see them on the skin, and you treat it with topical pediculicides and treat all the contacts as well as the environment. So throw everything in a washing machine with super hot water, and I guess you put chlorine or ammonia in that water, Dr. Neighbor Stevens.
Well, you actually need to be much more inclusive in your treatment regimen, including cars if they have upholstery in the cars, furniture that's cloth, mattresses. And yeah, if the clothes can tolerate Clorox, you can put that in it, or you can put Lysol in it. But the real thing that kills them is the heat in the dryer. Now, lice, I just want to say, is something that is something that pediatricians are called upon to deal with frequently. And in the last few years, and I'm not sure whether this is a national policy or a local. I don't know, Dr. Waltz, if you can help me on this, I appreciate it. But there is a move to stop making it mandatory for kids to stay home until their lice is gone.
I, I don't know what I can do to help with all the public health foolishness that's going on in America right now.
Oh, this predates that. Honestly, this predates all of that. The
Oh,
concern was that it doesn't cause any serious illness or anything, and the kids were missing valuable time out of school. That was the thought behind it.
yeah. Okay. Uh, okay.
And then next one, Dr. Walks.
Special populations and settings. Pregnancy, toxoplasmosis, faggot screening, and at risk. Avoid cat litter and undercooked meat. Immunocompromised folks. Worry about crypto, toxoplasma, spondyloides, screen before using steroids with them. The elderly or the asplenic, folks that had their spleens removed. Babesiosis more severe. In healthcare and congregate settings, we're worried about scabies outbreaks, C. difficile versus parasitic diarrhea diagnosis. Travelers and immigrants, tailored screening based on origin and exposures. This is that taking a good history part. Got to find out what folks have been doing and where they've been. Donors and recipients, transfusion and transplant transmitted infections. You would like to think that when you go for a transplant or for a transfusion, that all of the appropriate screening has been done for whatever might be transmitted. But again, if you're taking a good history, you'll find out somebody just had a transfusion, and maybe you could check a little more carefully.
Sometimes these doctors have got 6 minutes to see a patient, and they don't do everything as completely. So your family ought to be with you and help make sure that things are done in detail because you're at risk.
Well, Dr. Maxey, let me just add to what you just said. The opportunity is for those of us who are following Black Health Trust regularly. We will be able to create a list of questions so that when we do go with that family member, we can ask pointed questions because it only is 6 minutes. You don't have time to build a relationship and ask a whole lot of questions. But if you know which ones are relevant to the symptoms that you're going to see your doctor about, then it can make for a more productive visit for you and make for, the doctor can feel like you cared a little bit to think about what you were doing and to think about what questions you may have. So, what I got.
Excellent point. Let's go to the next slide, Simon. So let's put it all together. Number one, the triage you should do. Have they traveled? Have they immigrated any place? From any place? What exposures might they have and what is their immune status? It's very important. You want to do initial laboratory, make sure they're drawing their blood. And I ask people, say, have you been around any chickens or animals? Sometimes that eosinophil count will be high. A CMP, which is a comprehensive metabolic panel, the target is stool. Blood tests should be done. And imaging, if when focal disease, that could be got disease that's affecting one side of the body, or upper extremities. You want to look at the central nervous system. You want to know if it's hepatic or pulmonary in your lungs. And early treatment should happen if you have high suspicion of severe disease. And notify public health people about reportable diseases because you don't want this to spread and it could be very, very dangerous. So here's a checklist that we should do. Want to do this one, Dr. Neighbor Stevens?
Practical checklist. For food safety, you want to cook meats thoroughly. You want to wash produce. You want to avoid unpasteurized products. You do not want to prep your food, your meats with in the same on the same cutting board as you're prepping your other components of your meal. Water safety. Use treated water, filters that remove protozoan cysts, and avoid swallowing pool water. Vector safety. When you come in from being outside, it's time to do a tick check. And a tick check can't be done through the clothes. You have to take a look. You want to make sure that you use repellents as directed on the bottle to help keep the vectors from landing on you. And when possible, wear protective clothing. Beware, it's not on here, but beware of early morning and late afternoon, early evening. That's when a lot of the vectors come out in their heaviest, largest numbers. Pet and environment. Deworm your pets, cover sandboxes, and use careful hygiene in handling your litter boxes. Healthcare. Screen at-risk donors and recipients. Pre-immunosuppression screening for strong gyloides.
And can I just add, Dr. Neighbor Stevens, that this whole thing about the tick check, that can be fun. That can be a couples activity because it's hard to check certain areas by yourself. So Dr. Maxey, I'm talking about the back of the neck up here. I don't know where your mind went, but I was talking about having somebody check the back of your neck.
Okay. I want to go back to that science about the food safety. One of the things that we learned is that not only should cook food thoroughly, but there's a food thermometer you should use. You want to comment on that, Dr. Neighbor Stephen?
Well, depending on the type of food that you are dealing with, mostly the meats they say you should the internal, which means the at the center of your piece of meat, the temperature needs to be at least 165 degrees. So you
Mm.
can't eyeball it.
Yeah, and so there's an issue. A lot of people like steak rare, red meat rare. So I have a concern that that should be cooked to a certain temperature as well, and as well as poultry should be cooked like that. So everything, if you use that meat thermometer, that'll might not make your meat rare, but it'll make it well done. It'll kill most things you want to kill, except you.
So Dr. Maxey, one day when I have your kinds of resources, I'm going to be able to eat at those fancy restaurants where they say that our meat has been dry aged for 12 days. I don't know what that means because where I grew up, if you left meat sitting out for 12 days, you weren't trying to eat it. So maybe somebody can understand how you can let meat sit for days and days and days and then you still trying to eat it rare. I'm confused by that.
Yeah. I'm confused too. I wouldn't fool with it. Cook it good. Cook it
Okay.
to the right temperature. I think that'll kill whatever's there after all that aging. And I honestly don't know. But I've been to a couple of good steak restaurants. They say all you need is salt and pepper. I said, but to make it to a temperature.
Right.
Anyway, so thank you very much. Let's see if we have any questions or comments in the chat. You're pretty much at the top of our hour. If there are no other comments, let's go to our final statement for the day. Dr. Ivan Walks.
Uh, Dr. Maxey, I want to share with everyone that one of the most challenging courses I took going through my education was a class about um, parasites and what have you. And what you did not do today, and I appreciate it, is we didn't show pictures. That stuff that is trying to get into our bodies looks like it's trying to kill us. It's really very, especially you mentioned hookworms and tapeworms. We should really focus on making sure that the food that we are eating ourselves and the food that we are serving our loved ones, our family members, our kids, our grandkids, our close friends, when we invite people over, we got to protect them because I don't know who handled the meat before it got to my house, but I need to make sure it's handled well and it's cooked thoroughly. Thoroughly. I spent a lot of time earlier in my youth working in the food industry. I worked in a supermarket. I worked in frozen food. I worked in produce. I worked in the dairy box. I worked in all those places, and everybody isn't looking out for each of us. And so when we have opportunities to talk to folks about food safety and to talk to folks about making sure that parasites are getting into our body, it's a very important opportunity. And now you can let parasites get in your brain because maybe then you can become the Secretary of Health and Human Services.
You're being bad.
I'm sorry.
But he's correct.
I want to strike that last comment from the record.
We'll take out time and erase that. That's the neighbor Stevens.
Food safety in particular is something that we all should be very aware of because we most of the time like to eat. but we need to know how to eat safely. There are a lot of things we didn't have time to talk about. Again, salmonella in the eggs, listeria in the salads, the
Why don't you talk about
prepackaged
those
salads.
why don't you mention them real quickly? Why don't you speak about them quickly?
They can be sources, and most food scientists strongly recommend that you rinse that salad off before you consume it because you're
Uh,
eating it raw. It's not as big an issue with the pre-cut greens because you're going to presumably cook it. But if you're planning to eat it raw, you need to make sure you wash that too.
and one thing I learned about from my daughter about washing foods, her husband was a plumber, and he showed the contamination happens if you use hot water to rinse things, because that stuff gets sedimented in the water heater. So it should be cold water, not the water that comes directly out of the heater as well. And not only have metals in it and stuff, but also is somewhat contaminated. So for my final comments, I want to speak that next week we're going to have an expert from the pharmaceutical industry, uh, Mr. who's the executive of a company called Novo Nordisk, and he's going to speak about drugs that are called GLP-1s, which includes things like Ozempic and other drugs people have been using for weight loss and diabetes and other things. And I expect him to be comprehensive in talking about those drugs, the benefits, the risks, and how they fit into our modern day society. And hopefully the following week, I've spoken to Dr. Virginia King, who's a past president of the NMA and a member of the ACIP, who's been released, and she's the medical director of a public health board in Indiana. And hopefully she'll be on the week after that. So we have exciting information coming up. And I hope everybody has a good day. And thank you, Simon, so much. Thank you, Dr. Neighbor Stevens, and thank you, Dr. Walks, for trying to say these long words of the parasites. Thank you and have a great day.
Thanks,
Bye.
everyone.